I'm your host, Dale Sherbeck, and welcome to the HQ podcast. For those tuning in for the first time, the HQ is a podcast serial produced by CHA Learning and is your trusted source for important conversations on healthcare issues and topics from those that are leading and impacting the health system. Together, we'll explore these topics as we continue to learn together. CHA Learning is the professional development division of Healthcare Can and is uniquely Canada's only national fully online learning provider serving all of healthcare. So please check out more about our learning programs and services after this episode and discover how we collaborate with health leaders and organizations like those we feature on the HQ to empower healthcare professionals with the knowledge, skills, and relationships to impact health system improvement. So thank you, listeners, for joining me today for another amazing conversation. And I dare say that burnout was once, not that long ago, a dark secret that many, if not most, carried in silence and alone. So little did we talk about it that it seemed a rare thing that made having it all the more wounding. But as Christina Maslach and Michael Leiter write in their 2022 book, burnout is among the most significant on-the-job hazards facing workers today. It is also among the most misunderstood. In particular, we tend to characterize burnout as a person issue, a problem employees should fix themselves by getting therapy, practicing relaxation techniques, or changing jobs. Not surprisingly then, with many healthcare professionals choosing to do the latter, people leaving their jobs is partially contributing to a system in crisis, and those that continue to work in the healthcare find themselves increasingly overwhelmed and facing threats like moral distress and unrelenting demands, and so the cycle repeats and grows. How then can we address this pernicious issue that threatens individuals, those served by it, and the sustainability of the healthcare system itself? Is it a problem of knowing what to do? A problem of resources? An issue of values and culture? Something else? Some would definitely argue that many healthcare professionals fundamentally know what they should be doing to take care of themselves and where to go to get help, but they don't, as they put the care of others ahead of themselves. If that is the case for most, then how do you get past simple get-well fixes that are themselves somewhat tone-deaf to those in distress? To discuss this, I'm very grateful to be joined by Dr. Dayna Lee-Baggley, a registered clinical psychologist with training and expertise in clinical psychology, health psychology, and organizational psychology. She herself worked as a health psychologist for almost 15 years in multidisciplinary teams on medical, surgical, and cancer care hospital units with patients with chronic and life-threatening health conditions. She is an internationally recognized expert in acceptance and commitment therapy. She also conducts research at Dalhousie University and St. Mary's University, and she has an active research program on behavior change, obesity, chronic disease, burnout, and professional resiliency with 55 peer-reviewed publications and over 140 scholarly presentations. She is the author of the book, Healthy Habits Suck: How Do You Get Off the Couch and Live a Healthy Life, Even If You Don't Want to, and the co-founder and the chief scientific officer of the Impact Me app, a science-based workplace wellness app. Hi, Dayna. Welcome to the HQ, and thank you for helping us navigate this difficult topic and perhaps provide some help and hope and guidance to the many who are in need.
Thank you for having me.
So, as I described in my introduction, you yourself were once a healthcare provider in the system. So maybe you can just start there and give us a bit of, of your backstory and tell us about your background and what led you to your current work.
Yeah, so I'm a health psychologist primarily. That's what I've spent most of my career doing. So working on medical units in multidisciplinary teams. We were doing work on, burnout and resiliency for healthcare workers even before the pandemic. I was still working there for wave 1 and wave 2 of the pandemic. I left after wave 2 for my own burnout reasons. And also that I'd spent a lot of time sort of fixing up the individual and then sending them back to toxic workplaces. And so I wanted to spend some time fixing the toxic workplaces instead. And so that's led me to what I do now is helping workplaces come up with more comprehensive mental health strategies that address, a more systemic issues than just the individual.
Thanks, Dayna. So I guess the crux of this is this sort of you know pull between two different sides, I guess, as it were. On the one hand, and we're in a moment of significant transition in healthcare today. Uh, we're trying to transform a system that has been toxic at times or underserving certain parts of our population for sure, emphasizing new values and maybe challenging that they themselves may be challenging to some. And there's lots and lots of projects that are being implemented at the same time to try and improve on these things, which are putting more pressures on our people as well. So, how do we help and support professionals who themselves may be depleted, and yet on whom so much depends, really, and helping these organizations, undertake the transformation that we need?
I really think organizations in general and healthcare specifically need to think about their employees and their staff as their most valuable resource and to be investing in them. And so when we talk about burnout, we see, these problems that arise by focusing, I think, too much on what the individual should do. And as you mentioned, the research, on burnout is that burnout's a mismatch between the employee and their workplace environment. It was
Hmm.
never meant to be a medical diagnosis that an individual person should hold. And so we talk about that in terms of like the burnout burger, which that there's an individual that is squeezed between cultural and organizational factors that also influence burnout. So you mentioned, Dr. Maslach and Leiter, their new book. They have this great quote in there where they talk about canaries in the coal mine. And
Hmm.
so again, canaries in the coal mine were there to warn the miners that the oxygen was being depleted and that they needed to, get out, but no one ever said that the canaries should be more resilient. And yet somehow that's what we've done with burnout is to suggest that the healthcare worker needs to be more resilient and that they need to do more things. And so we've taken a different approach. So for example, we got funding during the pandemic to do a burnout intervention with frontline workers. And I was a frontline worker at that time. And I was
Hmm.
like, we are not telling these people that they just need to do more yoga or like meditate more. And so we did leadership training, which is one of the ways you can address systemic causes of burnout. And so we trained leaders on things that they should do to address their own burnout and things that would reduce burnout in their employees. There's actually a number of different factors that research has, identified that are workplace factors that would influence it. And so we did that, we did 3 randomly controlled trials with that, including with physicians leaders during the pandemic, and showed that we could reduce their burnout as well as reduce their resting heart rate, which is an involuntary indicator of stress. We did it in very real life conditions. We have weekly data where we actually show, like, here's where wave 3 hit of the pandemic. And the study showed that people who were in the active treatment were protected from the increase of stress caused by wave 3. And so that's about, helping leaders change the culture through role modeling, as well as address some of the systemic causes of burnout so that it's not just on the shoulders of the individual, that we're not just trying to make the canaries more resilient.
So, what are some of the examples, I guess, that you would be looking to, I guess, develop in those leaders that help in that space?
Yeah, so we talk a lot about role modeling behavior, and that's a way of changing culture. And so, we talk to leaders about how they need to be explicit about how they're recharging their battery. So we talk about recharging your battery instead of self care. We try to normalize that everybody needs to recharge their battery, right?
Yeah.
But we need to be more intentional about it because there's so many new stressors and drains on our batteries. And so we talk about how leaders can be explicit in role modeling that, what kind of messages they're sending. Do we reward people who worked overtime, right? These kinds of things. And then for the workplace factors, there's workplace factors like workload, which everyone thinks about, but there's other workplace factors as well, like autonomy and control, fairness, recognition and reward, community and connection, and values alignment. So there's actually a number of different things that organizations can do that will impact kind of everybody. And so often, workplaces kind of say, oh, we have a mental health strategy, we have an EAP. which is great, have an EAP. But that's once the crisis has happened. And we know there are a ton of barriers to help seeking. Organizations are missing an opportunity because they're relying on their employee help seeking behavior rather than finding other ways that would impact everybody, right? So we talk about how do you put fluoride in the water? How do you change the workplace so that it's healthier for everybody and doesn't rely on help seeking behavior? And then you can also have, those resources for individuals who need that in a crisis, but get more upstream by training leaders about how they can address these, workplace factors that we know from research impact burnout.
Yeah. So, yeah, I think that, part of what you're describing also in that modeling, I mean, that themselves is perhaps a challenge for some of our leaders. So, I mean, I know that one of the conversations we've had on the podcast has been around, vacation time, for example, right? And sort of this another sort of, I guess, moral distress about people feeling guilty about taking vacation while others are working harder, so they don't, or delaying vacation as a reward, as perhaps instead of as a mitigation strategy to getting ill. But with our depleted workforce, it's really hard for people even to take that time. So, I mean, what are your thoughts on that, or maybe other examples that you might want to share?
Yeah, I mean, I think this, one of the things that we talk about with leaders and with employees is about disappoint them now or disappoint them later. A lot of workplaces, including healthcare, have this notion that you can just keep pushing people and that it will work, that you somehow can just keep pushing them and bad things won't happen, or that you can just somehow fill the spots, right? So again, I worked in healthcare. I had many managers who would say, oh, there's just a lot of turnover in healthcare. Actually, there doesn't need to be a lot of turnover in healthcare. People are not spending any effort on retention strategies. It's a huge cost to the system to have to like find people, recruit them, train them, right? Just to have them leave. And so, those are like, again, cultural kind of ideas about that you can just keep pushing people and there's no consequence to that. And so, if, you either disappoint them now, meaning that you put boundaries in now about what you can do or not do, and you go on vacation, for example, which means that for a week patients are not being seen, or you disappoint them later, which means that people end up burnt out, they quit the profession, and now nobody can see somebody because that healthcare position is gone, right? That healthcare provider is gone. And so disappoint them later is always a crisis and always worse. But it actually requires us to tolerate some distress to disappoint them now. Right. And so, again, as a healthcare worker myself, it was the idea like, do I take a sick day today and cancel the 6 patients I have today? Or do I keep pushing myself and then have to take a week off because I get sick? Right. Disappoint them now or disappoint them later. But either way, you can't keep going. Part of the problem with healthcare workers, ironically, is that they're so resilient, right? That they can
Hmm.
keep going at such high levels of burnout that they will just keep pushing themselves instead of trying to fix the system. They'll just keep compensating for it. And so that was like a lot of the work we had to do with healthcare providers is how do you not save the system so that the system itself can get fixed? And yes, patients get harmed in the short run, but we are not better off now because people waited this long before trying to tackle these issues, right? We're in the disappoint them later. And it's scary to be a person trying to access healthcare in Canada, right? Because we know the resources aren't there and the healthcare workers are not there.
Yeah, to some degree, I think we take advantage of or take for granted, right? The passionate commitment that our workforce has to the profession and to the system and patients and families. So, but they're human beings with the same needs as everyone else. So, so maybe, I mean, you talked a little bit about some of the factors that we're facing as we facing burnout. Do you want to expand on that a little bit further or discuss more of those in more detail?
Yeah. So, for example, people think about workload and they sort of immediately think, oh, that means not seeing patients and increasing wait times, for example, right? But both the Canadian Medical Association and the American Medical Association have talked about like paperwork, right? Like
Yeah.
as like a burnout mitigation strategy of how do you reduce unnecessary administrative burden? How do you get rid of things that we actually don't need? And again, organizations are great, and hospitals in particular, of making more and more forms that you have to fill out, right? But not cutting back on forms, not decreasing the forms. This one maybe isn't needed anymore, right? And so, there are a number of initiatives across Canada of governments and hospitals looking at unnecessary paperwork that you could actually eliminate, right? As a way of not just not seeing more patients, but actually as a way of reducing burnout, for physicians, for example, or healthcare workers. So there are those kinds of things you can think about in terms of workload. It's not just seeing fewer patients,
Hmm.
but there's other things as well, like recognition and reward. So, for example, do people get acknowledged for their work, right? We have a tendency, again, to only focus when things are going wrong and to only acknowledge when things are going wrong
Yeah.
versus when things are going right. There's other aspects like fairness. And there's a number of different forms of fairness, which is called justice in the research literature. And so, for example, there's, procedural justice, which is like how a process gets decided. There's, the outcome of it. Did people think it was fair who got the promotion, for example? But then there's also like informational justice and interpersonal justice. Like, how do people get information? Does everyone get the same information about what's happening? How are people treated as part of the process? And so I really think that like leaders and managers have not been well trained in people skills, right? And so often managers become managers because they're the best widget makers, for example, right? But then you become a manager and it has nothing to do with widgets anymore. It's all about people. And we really have not equipped leaders and managers with these people skills to handle these things. And so they're faced with enormous, like, issues of like mental health problems and suicidality and, all of these things that they are not equipped to deal with, and that we really should be training leaders to have these skill sets. Again, there's a ton of psychology we could be using to help them understand how to manage people. And I think those skills are lacking, not because they don't want them, but because we haven't been thoughtful about training people in those kinds of skills.
Yeah, or the focus is on productivity or achieving results, right? As opposed to the humanity and compassion components of what it takes to for a team to be able
Yeah,
to accomplish those things.
ignoring the fact that if you treat people better, they are more productive, right? Again, seeing those as separate things that are somehow like if you treat people well, that's like the opposite of productivity. They're all related to each other. When people, one of the things we work on with workplaces, psychological safety, right? Which is there's physical safety, but then there's psychological safety in terms of like, your spirit or your emotions or your heart or your mind. Are those things safe at work as well? Right. Having psychological safety helps people cope better, right? So, one of my favorite, stories is there was research that they did where they had people stand at the bottom of a hill and estimate how tall the hill is. And if you're standing there with loved ones, we will estimate the height of the hill as being less than if you're there all by yourself. Then they
Hmm.
have studies where they have people carry a backpack and estimate the weight of the backpack. And even though they're not allowed to help you, if you're with family members, loved ones, we will estimate the weight of the backpack as weighing less than if we're there all by ourselves. Then they have some studies where they have people on a functional MRI and they administer a standardized shock to their toes. And so you can see the pain receptors of the brain light up on the fMRI. And if you're holding the hand of a loved one, your pain receptors do not light up as much as if you're there by yourself. Now, if you're holding the hand of someone you have a distressed relationship, it's actually worse than being there all by yourself. Because it's not about being with someone no matter what. This is about the benefit of like safe, trusting relationships. But when we have that, the obstacles don't seem as big, the burdens don't seem as heavy, and the pain doesn't seem as bad. That's not, we haven't changed anything in those circumstances. We have just tapped into the way humans function, that when you feel like someone has your back, life feels more manageable. And so helping workplaces create psychological safety improves productivity, right? Because people see those challenges as more manageable, right? And it's also like good for their own well being.
Yeah, one of the what social determinants of health is social connection and family, right? Yeah, I think it's a great example in terms of how that is just as relevant in our workplaces too. So
Yeah. Again, we have this like outdated kind of view of that there's like your personal life and then there's your professional life and they're somehow totally separate and you can pretend to not be a person when you show up at the workplace, but that's not how humans work. They show up as like the messy, flawed humans that we are, right? And we need skills to help people understand how to manage messy, flawed humans who are not logical creatures, who do not just do what you tell them to do, right? But again, there's a ton of psychology that we can use to help people, have different conversations with people that then improve these relationships and improve, things like psych safety in the workplace.
Yeah. So maybe moving in from that, Dana, so there are lots of tools, obviously, for managing stress and improving mental health and wellness. I mean, you've talked about yoga and, right, meditation, deep breathing, right, hydration. I mean, sure, we all know what most of those things are. But why isn't it as simple as just telling our healthcare workers, to do those things, right, to breathe mindfully or practice some of these other behaviors in their spare time?
Yeah. Well, one, they don't have that much spare time, right? So if you talk to healthcare workers, they are, working a lot of overtime, all these things, again, because there's not enough people to run the system. And again, most people know what they should do. The challenge is actually getting people to do it and to stick with it long term. So when we work with the individual, the thing we're focused on is the how of change, not just the what of change, right? And so, again, there's a ton of science of behavior change that we can help people use to find more time in their day, to be able to replace that with recharging activities, to make that, one of the key questions we ask people about recharging is who benefits if you're more charged? Right. Because we get caught up in this thing about I'm being selfish, right? This is time away from my family. It's time away from my work. But actually, if you are more charged, everybody that you care about and all the things you care about, and probably all the people you interact with are going to benefit from that. It's actually not just for you. And so we have this notion that we have to convince people to put themselves higher on their own priority list. It's usually a tough sell. And it's a tough sell in healthcare workers because they've been trained for decades to not put themselves first. Right.
Yeah.
And so instead, we want to link it to the things that are already at the top of their priority list and show them that recharging their battery is in the service of those things, right? That's why you're doing it for your patients, you're doing it for your family. Yes, you'll benefit, but all these other people will benefit as well. But then I think the second thing is that we need to stop doing so much about the individual and again, change the workplace, right? Train leaders to have the skills to address the systemic and cultural factors in burnout so that it's not just on the shoulders of the individual, right? That we're tackling these other things. That again, there's a lot of science that we could be applying here. People don't need to like reinvent the wheel or come up with new things. We know a bunch of the things that we can already be doing.
And just to be clear, I guess, so it's not an either or, though, right? I mean, people still need to practice, good personal behaviors that, are modeling self care, but creating a safer, more inclusive workplace is going to contribute to those things having perhaps better impact or reducing the harm itself.
Yeah, I think when people know that you're trying to tackle the systemic causes of burnout, they're actually more willing to invest in their own self care as well, right? When healthcare providers continue to get the message that it's all on them, that they're just not doing
Yeah.
enough self care, right? They don't want to do it, right? And they face a number of barriers. We did a study with Health Canada on mental health resources for healthcare workers during the pandemic, and a lot of we did a survey, and a lot of the feedback was, I don't even have time to do these things. It's time, how am I going to find time to go for a therapy appointment? How am I going to find time because I've been asked to do all this overtime, and nobody is letting me take time off, right? So. I remember somebody asked me once about like how long does it take to recover from burnout, right? And I was like, well, if you go back to the same workplace that was causing your burnout, then I don't know why you think it's going to stop, right? Again, you can't just fix the individual and not change the environment that they're in and expect them to get better. And so we want to do both, right? We always talk about empower the individual, empower them with science based information that is about them working smarter, not working harder. Just
Hmm.
try harder is not a science-based strategy, right? And then also target these cultural and systemic factors so that it's all working together. And I think that makes, individuals more willing to put in the work for themselves when they know that their workplace is targeting these other factors as well.
Yeah, and I guess that's part of also. I mean, you talk about rewards and recognition, but I think perhaps historically, right, some of those rewards and recognition, whether it's, even in the form of chocolates and a coffee gift card or something, in the absence of organizational change, may feel insincere or incomplete. So I think it's perhaps I think that's part of, I guess, connecting those two things together, and what you're describing is the more holistic sort of approach to wellness or retention, even if we might put it in those terms.
Yeah. And again, we often reward people in healthcare for working overtime, for taking on more patients, for staying late, right? That's the cultural part of healthcare that makes it very difficult to engage in self care because all the recognition and reward is about not sleeping and putting your patients first and doing all these things that harm your health but help the patients. And that then, is if that's what people are getting rewarded for, that's what they're going to keep doing, but you put enough stress on them and eventually everybody gets burnt out. And what happens in healthcare is that they leave the profession, right? They don't just take time off, they often like leave the profession entirely.
hmm So earlier in our conversation, you talked about justice and fairness, and so maybe just coming back to that a little bit, Dana. What is the relationship, I guess, between health and wellness and justice, equity, diversity, inclusion, and why is behavior change important to consider in relation to these Jedi efforts?
Yeah. So when we think about things that can be drains on our batteries, social determinants of health are a big one, right? If you have housing insecurity, financial insecurity, those are big drains on people's batteries. And again, we have this tendency to focus just on what the individual is doing and sort of ignoring the social factors, the cultural factors, the other things going on in their lives that influence it. We used to see it all the time when people were trying to make changes because they had a chronic disease. They get diabetes, for example, and they need to make these lifestyle changes and they're being told they need to eat more vegetables, but they live somewhere that where there's a food desert and there's no vegetables in any close proximity,
hmm
right? Even things like go for a walk and de-stress. Some neighborhoods are not safe to go for a walk in, right? And for lots of racist reasons, it's not safe for some people to go walking, right?
Yeah.
And so we need to take those things into account if we really want people to be well, and addressing those factors can help people be well. And so I think one of the limitations of the way we're working on diversity and inclusion right now is that again we haven't embedded the science of behavior change. And so what we need is people to change their behaviors on a daily basis in terms of how they interact with other people. And so, again, the work that we do with organizations on Jedi work is about changing behavior and how do you sustain that behavior. Again, finding value driven reasons for change so that it's not a check the box activity, that's something that you keep doing. Finding ways of, behaviorally describing what it looks like. So we tell a lot of people what not to do, but that's not the science of behavior change. You want to tell them what to do instead, right? So clarifying the do instead behaviors, having a way to acknowledge mistakes, right? We need to be able to make mistakes as we're learning, and so we need a way to communicate that. So often it's about giving teams language about how they can talk about making mistakes when they misunderstand each other, for example. And then understanding the internal things that show up, like biases that are just part of human brains. And so we can't change the biases, but you can change your behavior. Right. You can recognize when the biases are influencing your behavior and choose more inclusive behavior instead. And so again, I think this is part of what's lacking in a lot of interventions for this now is that again we haven't made that training into something that is about behavior change and a more lasting effect.
Hmm. Interesting. So I'm just wondering, as bringing some of this together in terms of how does what you've been describing here impact on a sense, a person's individual sense of belonging, I guess, within an organization, and how does that contribute to, um, you know, managing burnout or mitigating it in the first place?
Yeah, so we know that belonging is like a fundamental human need, right? Basically, humans over time have always needed other humans to survive. And so the forces of evolution, we're not person versus person, they are actually tribe versus tribe. And that's why humans have so many social emotions that are about having the tribe survive and not just the individual survive. And so we're hardwired, right, to feel better when we feel connected, to safe trusting other people, and to feel distressed when we don't. And we see this in like the loneliness epidemic, for example, right? That loneliness can be just as harmful for your health as smoking, for example, because it's a very, hardwired thing in humans that we need to feel connected to other people. And so having a sense of, inclusion or belonging in the workplace involves both feeling welcome, so feeling like you belong, but also that you can be your unique self. And so it's those two aspects that, define inclusion is that I feel welcome, and I feel like I can be myself. And so again, that's the same hard wiring that we talked about earlier about that changes our perception of the world and makes us feel more capable of doing things. And and if we were training people, leaders, for example, teams, for example, to focus on these kinds of skills, they're not things, that take a lot of money, for example, to do to help people feel more included in their workplace, but they have a dramatic impact on people's well-being. And so that includes both, patients as well as healthcare providers. I used to work with a lot of medical residents, and they were experiencing a lot of discrimination in the workplace. And so it's not just patients that are being impacted by these things, but also healthcare providers are being impacted as well. And so these are the kinds of, again, psychological knowledge that I think we possess, but we haven't translated properly into the workplace. We haven't translated that into actionable, implementable things that we could do that would, improve people's lives.
So, taking all that together, Dana, I guess as we sort of come to a bit of a close, but I mean, what would be your guidance to healthcare organizations in terms of where to make investments or change? Because we've talked about lots of different things, and that there's certainly a responsibility within organizations to create these spaces. But so, where do they put their money?
Yeah. So if I was an organization, I would focus on leadership training because it's your fastest way of making systemic change. There's other things you want to do to make systemic change, including policies and other structural things like hiring practices, things like that. But you can have the quickest effect if you're training leaders, and leaders themselves are also burnt out, and so giving them the skills to that equip them with the skills that they need also helps their well-being, right? And I would also encourage organizations to think like, is what you're doing actually science based? There's a lot of training and stuff in workplaces that has no science behind it and has no validity to it. So even when we talk about Myers-Briggs, for example, there's no
Hmm.
independent evaluation of that. So they probably have a huge database of information, but there's no independent verification of that. And no other scientist studies those personality dimensions besides Myers Briggs. And so, are we actually using things that are science based, that are theory based? I think that's both the responsibility of researchers to translate their work faster and more efficiently and more, you know, uh, so it's more useful and day-to-day basis, but also for organizations to think about whether there's any science behind what they're doing, because there is science that we could be using. It can help leaders, and that will have an impact on their employees as well.
Thank you. Great wisdom, and certainly opinions that I share. So, in terms of the importance of developing leaders. So, um, any other words to you then, Dana, in terms of bringing this full circle?
Yeah, I would just say that, part of one of the other reasons that I left the hospital after wave two was that, I was doing therapy with one on one therapy with cancer patients, which is clearly a meaningful thing to do. But the
Hmm.
mental health needs of the planet had like exploded. And for me, I was like, this isn't going to cut it. One on one therapy works great, but it's not going to meet the needs that are out there. And so from that point forward, I really focused on what can I do to make science more accessible? What can I do to increase access to science based science-based information. And so that's a lot of what we've tried to do is really translate our research into practical, scalable things that people can do, every day that can help them. And so these are not, skills that are going to treat mental illness, for example, but they are skills that would help a lot of people suffer less and understand more about how humans work and how to have their interactions and with other people and how to improve their lives. And so I think that is both the responsibility of researchers to make sure that their work is being translated into useful things that an everyday person can use, as well as organizations and being thoughtful about what they're purchasing and what they're investing in.
Yeah, thank you, Dana. And I think I would, you know, iterate, I guess that I mean I appreciate that you yourself have helped in translation of that and into clear language, specific comments and topics here that I think any of our listeners should be able to sort of take and move with, and to investigate some of them in more detail in terms of what they can do to invest in themselves to make some of these things happen. But you've made, I think, the topic a lot more accessible and real, and given us some clear advice in terms of places that we can act and make a difference.
Yeah, well, thanks for the opportunity to, this is now part of my values and how I want to contribute to the world is it's really in a big scale to help reduce human suffering, but on a day-to-day basis about how do we increase access to science-based information so people can live more meaningful lives and flourish more. And, I have a deep love of the healthcare system. It really was a challenge for me to leave the healthcare system. I applied for several more jobs that were totally inappropriate for me just to stay being a healthcare worker. And finally, I was like, all right, I just need to go do something else. And so we really would love to work with healthcare organizations, and we just find that they're in such crisis right now that they can't get ahead of it. They can't get beyond the crisis to do something proactive, and so it's really hard, to shift those things. But I think individuals and leaders and organizations need to be again value driven about what kind of environment they're trying to create, what kind of world they're trying to create, so that they can make some of those hard choices that again might be hard in the short run but create a more sustainable system in the long run. We do not have a way of having a sustainable system.
No, and I think the perhaps part of the challenge that obviously that we're facing is that the scale of the problem seems somehow overwhelming for lots of people to be able to tackle it. At the same time, the scale of the problem is perhaps focused our attention on the issue more than it's ever been before because it's not a new problem, and more resources are being put into this than we've ever seen. So, you know, I'm hopeful, right, that people are now talking about the issues that need to be talked about, and that we are going to start to see incremental change, perhaps contribute to wholesale system changes down the road.
Yep. There's a definition of hope, which is, wanting a certain outcome to happen. And there's a definition of hope, which is belief in the possibilities. And so it can sometimes be tricky to have hope when you want a certain outcome to happen, like this change must happen in the healthcare system. But we can have hope about the belief in possibilities that maybe, as things deteriorate, it actually gives us options to create brand new things in their place, to not be doing band-aid solutions, but to make more change because things, are so stressful in those environments. And so we could have that, belief in possibilities that we can make it something that's healthy for everybody.
Yeah, I'm not sure if it's Einstein or some other thoughtful leader, right, that talks about that hope is a moral imperative of all leaders, right? So, and so without our leaders having hope, then really, where else do others sort of draw that strength from?
Yep. And, we talk about, because it can kind of feel like a bit of an apocalypse, which is
Yeah.
not the end of the world. Apocalypse meaning a time of great change, right? But it's especially important to think about who you want to be in the apocalypse, right? It's especially important to think about what you want to contribute to the world and how you want to show up and how you want to take care of other people, right? And if we could change those thoughts about, healthcare workers being the most valuable asset and what we need to do to protect them rather than putting patients first, that actually would result in better patient care. It would result in better outcomes for patients. right? And that you can make those changes. We talk about like on a daily basis about making changes. All those things really do add up, and then get together with other people who believe the same thing so that you're working together with other people to make change, right? But we absolutely can make change. And the pandemic was obviously a really stressful thing, but also showed us how we could pivot and do radically different things that we had never done before, right? Just because we decided to do them. And so we need to take that same spirit of thing, like we can do things radically different, and we're completely capable of it, right? We just need to be headed in the right direction about investing in people first.
Wonderful. So yes, I think every crisis obviously presents us with a glass half full, half empty sort of opportunity, and I think that you've shared us with us here, certainly as a close here, how that glass is half full, and the opportunity to do so much more. So thank you again for a wonderful conversation, uplifting, and hopefully it inspires the change that we all want to see.
Thank you for having me.
Bye bye. You've been listening to the HQ, and I'm Dale Sherbeck, your host. You can find this and other future episodes on the CHA Learning website, Apple Podcast, or Spotify. We'd love to hear what you think, so please follow us on our other social media channels. Thanks for joining us in this discussion today. Please join us next time.